Hi, my name is Sharice Dominguez, and I'll be doing a skills video of inserting a peripheral IV and discontinuing one. So I will start with inserting the peripheral IV. I will come in and introduce myself to the patient. I explain to them that I'm going to be inserting an IV for fluid rehydration. I'm going to do hand hygiene. I'm going to put on gloves. So I have all my supplies. I have a IV catheter, the IV extension, a IV start kit, and the unexpired saline push. I also have my trash and sharps. So I'm gonna start by flushing the IV extender with the normal saline. Just making sure that there's going to be no air in the line. And push that through. Okay. Okay, and I'm going to cleanse the area by using a alcohol swab. So I'm going to do a circular motion inside out. And then allow time for that to dry. Then I'm going to get I have a 22 gauge. My patient is a 75-year-old male who needs fluids for rehydration. There's no anticipation for surgery or blood products, so I'm going to use a 22 gauge for patient comfort. I'm going to get the tourniquet. I'm going to put it on the arm about 4 to 6 inches above the anticipated insertion site. I'm going to put the tourniquet on tight, but not too tight. We don't want to completely, we still want blood flow, so we don't want to completely make it too tight where there's no blood. And to make sure, we're going to check the distal peripheral pulse, make sure we can still feel it. If we can't, then we're gonna undo the tourniquet and redo it where we can feel the pulse. So now the site's clean, and I'm going to start the IV. So I'm going to make sure that the bevel is up. And I'm going to anchor the vein about 1 inch below where I'm going to insert the IV. I'm going to go in, and then I'm going to wait for blood return. And once I see the blood return, I'm going to going to advance the needle about 1/4 of an inch so that catheter can get into the vein. Then I'm going to put the needle kind of parallel to the arm. I'm going to slowly advance the catheter. And then I'm going to retract the needle, put this in my sharps, undo the tourniquet, and I'm going to anchor the catheter, and then I am going to connect the catheter to the extension to the catheter. And I'm going to connect the saline. And as I'm doing this, I'm going to push back to make sure I get blood return. And once I do, I'm going to slowly administer the saline, and as I do, I'm going to look for any kind of signs of infiltration, like swelling, discoloration, pain, and if there is for any signs, to redo the IV. So everything looks good. Sometimes the IV extensions will have a clamp. If it doesn't have a clamp, I'm going to put a cap on it. Okay. And then I'm going to do the Tegaderm bandage right on there, just so it's transparent so we can see the IV. It holds it in place while we can like view if there's any changes to the surrounding tissue. And then once we have that secure, we're gonna say we are going to document the time, the date, the gauge size, initials, and we're going to put that in there. And then I'm going to go and take the catheter, the IV extender to the arm to make sure that it's secure, doesn't get pulled on anything. And as I'm taping it to the arm, I'm going to make sure that the tape isn't touching the transparent bandage. And then I'm going to put my trash away and anything else that needs to go into the sharps. And then I'm going to make sure the patient's okay, ask if there's any pain, discomfort, if there's anything else they need. And then I will remove my gloves, do hand hygiene, go ahead and document the procedure and how the patient tolerated it. Right, so now I'm gonna discontinue the IV, the peripheral IV. I got doctor's order that patient is been appropriately hydrated and doesn't need the IV no more. So I'm gonna come in, do hand hygiene, explain to the patient that I'm gonna be discontinuing or removing his IV. So upon assessment, I'm going to be looking at the IV, make sure that there's no abnormalities I see, no like swelling or discoloring. Alright, so I'm going to untape the IV extension. I'm going to get a clean gauze and then start to, I'm putting pressure on the catheter, like maintaining it while I take the bandage off. And then as the bandage comes off, I'm going to put this clean gauze on top of the catheter, and then I'm going to slowly remove it and then put pressure for at least 30 seconds or until the blood is stopped. And as I'm putting pressure, I'm going to inspect the catheter, make sure that there's no I'm going to look at the length. I'm going to see if there's any blockage or anything that could have caused an issue. And then I'm going to put this into the sharps. Okay. And then I'm going to check to see if there's bleeding. And if there's not bleeding, I'm going to get another clean gauze. I'm going to put that over it. And then I am going to get tape. And then tape down the gauze. Okay. And then I'm going to remove my gloves. Do hand hygiene. Assess the patient, make sure they're okay. And then I'm going to document how patient tolerated it, what the catheter looked like. And yeah, thank you.